Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by the South Carolina Department of Health and Environmental Control. Visit scdheck.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. In it together and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, contact Agape Counseling and Training Services at agapects.com. And Palmetto Media Connections, connecting media and communities together. Coping with COVID, brought to you by SCDHEC. In it together, the Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.
Happy Thursday. I'm Tre Tailor, and thank you so much for joining us once again for Coping with COVID. Updates on the pandemic and information to help you thrive and survive COVID-19. I'm Tre Tailor, and we're getting you ready for the tax season with all the COVID payments. Some things are different, and Kadenia Javis is here with Javis Financial Services to update us on everything. Kadenia, Happy New Year, and thank you so much for joining us.
Happy New Year to you too, and thank you for inviting us.
Absolutely.
Wonderful time of season, wonderful time of the year.
Tis the season for taxes, and this is your sweet spot. So we're going to talk to you coming up next about all of the tax information. Thanks you so much, Kadenia. We appreciate you.
Thank you.
Absolutely. Also, Shelli Quenga is supposed to join us from Palmetto Project. If she joins us, she'll talk about Medicare updates. That and more coming up next on Coping with COVID. But first, your COVID community updates. Governor McMaster says the state will not shut down again. This is the first time the governor has spoken out in reference to the Omicron variant and said that there are enough testing sites, enough vaccination sites, and vaccines. And he is asking residents to be patient because lines may be long at the almost 1,000 free locations statewide. Now, he did say he is focusing on education. South Carolina schools have a 32.7% positivity rate for COVID. Speaking of schools, in response to the increase in COVID cases and the Omicron variant, Richland School District 1 has revised their safety policies for the remainder of the school year. Students, teachers, and staff will have to be masked. Plexiglass will be placed on students' desks, and proof of vaccination must be shown. Now, in Fairfield County, the school board voted during a special meeting yesterday to require masks regardless of vaccination status. Richland School District 2, Kershaw, and Orangeburg counties have also revised their COVID guidelines. And check your lottery tickets. 2 people have won one of the largest Powerball jackpots in history. Now, tickets for the $632.6 million prize was purchased in California and Wisconsin. The payout will be around $225 million for each winner, the first time in 3 months a winning ticket was sold. SCDHEC has your most up-to-date list of times, dates, and location for COVID testing, vaccinations, and flu testing in and around South Carolina. Visit scdheck.gov for more information. Now, if you are a veteran, COVID vaccinations are being held at the VA. You can see that information on the screen. Several retail outlets are also offering COVID vaccinations. Kroger pharmacies, CVS, which includes the CVS at Target stores, and also Walgreens are all offering COVID vaccinations for both adults and children. Brooklyn Baptist Church's vaccine clinic is also open 7 days a week. You can see that information on the screen there. And also the Comet bus system. Not only are they offering COVID vaccinations at their Laurel and Sumter Street location, you can also get a free ride to get your vaccination from the Comet. Don't miss your shot. Catch the Comet to get your vaccine for free. Also, if you are having a challenge making your COVID vaccination appointment, Get Set Up is helping seniors and others who are technically challenged. You can contact Get Set Up at the number listed on the screen. And Get Set Up Also, FEMA is still doing COVID funeral reimbursement. If you have a loved one that passed away due to COVID, please contact FEMA to see if you qualify for a funeral reimbursement. The South Carolina Bar Association and SC Legal Services have a toll-free number and website to help you with rental and mortgage help. Also, Lexington County has a bill assistance program. SC Housing and Dominion Energy has an assistance program for both rent and utilities. SC Housing also have a frontline workers and home buying assistance program. All of these resources are free and available for you if you need some financial assistance due to COVID. Now, if you or someone you know is having a challenge coping with COVID, contact SC Hopes. It's a 24-hour assistance line from the South Carolina Department of Mental Health. Finally, the City of Columbia MLK Food Distribution Program is going on. You can donate anything, any non-perishable food item through Monday, January 17th. They need canned fruits and vegetables. Anything that you can donate it will be appreciative. You can see that information on the screen. You're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. I'm Tre Tailor, and we're streaming live on the Tailor Made production page on Facebook. That's the home of Coping with COVID. Would you go over there, hit like, follow, and share so that not only you can get notifications as to when to watch Coping with COVID, Wednesday, Thursday, Friday at 2 p.m. Eastern Standard Time. You can also get all of your COVID-related updates. Now, we're also streaming live on YouTube. Want to say hi to all of you YouTubers. Please hit the subscribe button. And listen, if you want to check out past Coping with COVID shows, that's the place to do just that. We also have a presence on Instagram and also on Twitter. Now, all of the information that I just mentioned, all of that information about resources, testing, all of that, that'll be scrolling at the bottom of the screen. So please check it out, and please continue to hit like and share so that we can get the message to the masses. Well, 'tis the season for taxes. That's right. But it is going to be a little bit different for many with all of the financial concessions related to COVID. Kadenia Javis is here with Javis Financial Services to tell us all about the changes. Kadenia, thank you again so much for joining us. This is your busy season, isn't it?
Yes, team no sleep.
Well, look, good thing you just came back from a long vacation. So
yes, we definitely go on cruise control in December because we know how it's going to be, the next 14 weeks. We had a stressful season last year, due to the pandemic, and it's going to be a replication this year as well. It is.
Yeah, I was going to ask that. Are you expecting it to be just as hectic this year?
Yes, it will be due to the simple fact that we had that third economic payment.
Yeah.
So that's where the delay is going to come in at. And so last year we saw with the different changes that happened January, February, and then the unemployment credit, stimulus payments, they were issuing and getting those out before the tax payments.
Yeah.
So again, Congress, every time they meet, things change. So I'm sure that there are more changes to come for 2022 that are not finalized yet.
So let's talk about, so you're saying that there may be more changes as we go on before the deadline.
That is correct.
Wow. Wow. All right. Well, we got to get you back on if something comes up.
Okay, and we thank God when it came to the unemployment, because so many people were on unemployment, and then President Biden decided that the first 10,200 would be non-taxable. So that was awesome. And I thank God we didn't have to go back and do those amendments. The IRS did it. The IRS did it for us. Yeah. So Treasury sent back refunds if anybody was entitled to refunds. Okay. So that was awesome.
So let's talk about this coming tax season. And you talked a little bit about all of the funds that were distributed last year. What do filers need to be aware of that may be different? I know there are at least two different things. One is the child credit. Let's talk about that.
Okay, so the advanced child credits that began this summer through December, know that those were advanced child credits. So those payments can either reduce or it is going to reduce your refund 9 times out of 10. It all depends on a lot of different variances with income and other dependents as well, because they were able to get $250 for those children that were 6 through 17, and then they got $300 per child under the age of 6. So all those advances will be deducted from their 2021 tax return. Need taxpayers to know that. As well as if there's a different person filing that child, the person is going to have to be reconciled. We recommend that whoever that child was in the resident, whoever that child was in 2019, that needs to be the same person, because if it is not, I'm telling you, those refunds can be delayed up to a year. We've seen it last year where we filed taxes in February and it was August, September, October before taxpayers, before the system, because you have to realize those are, even though we electronically file, there are still people behind the scenes that process and push buttons. And when numbers don't add up, socials get on a different return, it goes to a different verification process. And if it gets kicked out of that in that verification process, though, they still have treasury workers working from home. And so it takes longer. And all I can say is COVID-19 pandemic taught me patience. It taught me patience. And that was, there was an unlimit on those advance payments per the children. So it was not a limit, whether you had 2 children or 5 kids, because, when you file a tax return, there's a limit. You only get credits for up to 3 dependents on your return. That's why when they advertise, you get how much you get for 1 child, 2 child, 3 child. But if you had 5 children on that return, you were getting that advance credit for all 5.
Right. Okay. So there is a letter that people will get that receive that tax credit, and that is letter 6519. Now, what will that letter say, and what do people need to do with that letter as it relates to filing their taxes?
All right, so it's 6419.
6419, okay.
And those letters have already started going out. Please take those to your accountants or your tax preparers, because it is so much easier for us to reconcile on the front end versus it not being correct. And the IRS has to correct it, and that's what causes the delay. As well as, Trey, there's a form 6475 for the $1,400 that we all received per dependent. That amount changed from the EIP, which is economic injury payment, from the first time and the second time. So the third time it was $1,400 per dependent per taxpayer. And so that number has to be reconciled as well. That letter should be bought in so that your accountant or tax preparer can have the right amount. Because what we saw that happened last year, monies went to different people's accounts, or if the treasury, if they changed address and if they thought that it might have been identity theft, they took it off direct deposit and mailed those checks out. Well, if that taxpayer moved, government checks normally are not forwarded. So people were telling us, no, I did not receive my $1,200. No, I did not get my $600, but the 12 and the 6 were issued to the taxpayer. So that caused another delay, because now we got to do a refund tracer to see if the checks were cashed. Now we got to go to the IRS, update your address. So we definitely, it's going to be another year, just like last year. And we're definitely pleading with taxpayers, please wait and have these forms so that we have the correct numbers. And just know that if you try to guesstimate it, it's definitely going to cause a delay in your processing your refund.
So 6475, 6419, these are 2 letters folks who receive some type of child tax credit will get in the mail. And these letters have the amount that they sent you. Now, whether or not, because what I hear you saying is you may not have gotten that, but that's how much they sent. So here's the thing, Kadenia, do you put down what they sent, even if you think you didn't get that much?
No, that's where they have a form called the recovery rebate credit, where we have to go in, and it's almost like checks and balances, debits and credits. Okay, they say they sent you $1,800, you only got 12. So we're going to put in what you say you got. And then if you didn't get it, of course, then it's going to take time for them to do the research, and they'll come back to you and say whether they mailed it, it went to this bank account. And it has been issues of identity theft. It has been issues of fraud. It has been issues of people stealing, social security numbers on the black web or whatever they call it. That's always going to happen. So We are also advising, it used to be where the Department of Treasury would issue you a identity protection pin, IP pin. It's a 6-digit pin number, and they'll give it to you for 3 years when you were a victim of identity theft. We're asking taxpayers to be proactive. This is what they were kind of teaching us this tax year in classes too. Have your clients go ahead and be proactive, get those IP pin numbers, so when nobody can't use their social or their children's social. So that was a good thing, and we're trying to encourage our taxpayers to get those IP PIN numbers in advance, as well as Treasury has made it easier now to get your accounts, e-service account, so that way you know what monies was given out to your social and where it went to. It will tell you if it went direct deposit to what bank, and then that starts our research process a whole lot easier. So those clients, but they have to be in front of you in your office if you're assisting them, because the IRS has that, what they call it, multi-function, 2-step verification. So it's going to send them a text, it's going to send them an email to verify that they are the taxpayer before the IRS will release any transcripts or account information. But we love that feature that they've come up with now. So actually past, if you lost your returns, now we can go back to 2013 and recover W-2s, wage, and transcripts.
That's good. All right. So you said a couple of things that I want to clarify. One is the eServe. What is that for people who don't know?
The eService is is eService, and it's where the IRS, you can create your own account, and you can see what W-2s have been issued to you. You can see if any 1099s were issued to you. It will have a record of your account transcripts, whether you filed your taxes. Some people have back taxes that hadn't been filed. Some say it's because they lost their W-2. Well, in that e-services account, it's your social, and you need to go in there and create that account so that you know that all income information that has been reported is accurate, because it could be wrong. And sometimes it's just data entry errors, transposing a digit. The last digit may be wrong. And so somebody else's income, it may be, $100,000. But no, that's not mine. And so you go in and you see, okay, well, that company has to send in a correction. So it's a lot of research that has to be done. But those IRS, the e-service feature that they've come up with for the taxpayer to create is used to be just for tax preparers. Well, not just for tax preparers, but it hasn't been a norm. But these last 3 years, we're not in the norm, and a lot's going on behind the scenes.
So where do you go? Do you go to irs.gov to set up your e-service account?
You do, and go to individual taxpayer records, and there's an online link to start you to creating and going through the verification, because it's going to ask you questions like, where did you live when you was 10 years old? What car did you have financed? So if somebody stole your social security number, they 9 times out of 10 wouldn't have that personal information or know who you got, a mortgage finance with. So it asks those kind of questions. So that's why we like for the taxpayer to be in our office, because it's going to ask some very intimate questions that only that taxpayer would know.
Yeah, we're talking to Kadenia Javis with Javis Financial Services. She is giving us some information about the upcoming, I won't say upcoming tax season. We're in it right now, the 2022.
We're in it.
We're dead in it, tax season. I love the e-service thing. So let me ask you one more thing about e-service. Will they have, because you said they have all your W-2s, all your W-9s, everything. Will they have it even before you have set it up? For instance, if you're just now setting it up, will everything kind of download from the past?
From the past, yes. Your current 2021 stuff won't be there yet, because businesses have until the 31st, and then if you got any brokerage or interest accounts, they have until February 15th to report. But I just created mine last week, and I downloaded all my account information all the way back to 2013, just so I could have. Since I know it's there, I'm like, wow, let me go back when I get some time. I'm gonna go back and look at make sure everything was accurate. And also another thing, Trey, that's new this year is you don't have to itemize to claim charitable contributions. You can claim up to $300 to a charity without having to itemize. It used to be where you had to file a Schedule A to itemize any charitable contributions, but this year you do not have to itemize to claim that extra $300. And that $300 may take a person from a negative red to a positive black. So
Yeah.
any legal tax code that is given to us as taxpayers need to be utilized. And definitely you need to have an accountant, a bookkeeper, a tax preparer that is staying abreast of these new tax laws.
Yeah.
It's advantageous for the taxpayer, not just a data entry specialist.
Right. So it was another thing that I wanted to ask you about that you were talking when you talked about the e-service. You also talked about an IP.
IP PIN, identification.
IP PIN. What is that, Kadenia?
The IP PIN number in the past, when you were a victim of identity theft, first things you would do is file a police report. And second, you would notify the Department of Treasury. And then you also notify all three of the credit bureaus. And so in return, Department of Treasury would issue you a 6-digit PIN number every year for the next 3 years. They only used to give those IP PIN numbers out when you were victims of identity theft. But because identity theft is on the rise and everybody's at home and has time to be at their laptops and computers, now you can get that IP PIN number proactively. You can ask for it. You don't have to be a victim of identity theft. You can get that PIN number, and you gotta have it. Once they assign it to you, you have to file it with your taxes. If you forget it or you lost my IP PIN number, because it's gonna take an act of Congress for you to get it. So it's definitely save that number. And you have to file it with your tax return. And again, it's something you do every year. So they'll give you another one for the next year. But it's not hard to do.
So you're getting it from the IRS? Where you get it from?
Yes,
okay.
IRS.gov, and it's as well. It's an online tab that says IP PIN, and it's the identification. And you can also get it for your children, because there's situations where you go through a divorce, or whatever the situation is family wise. If your children, the mother may file the children the even year, the father may file them the odd year, and it will protect you from that other spouse if they don't be their due diligence and they go and claim first, because it's whoever gets gets to the IRS first with the acceptance. Now you can go back and correct that and do an amendment and send in paperwork, say, hey, I got a court order that says I'm supposed to file my child this on the even years, but my ex-spouse did it. It just, but if you get that IP PIN number, nobody can file your child or your social without that 6-digit number. It's almost like your PIN number to your debit card. That card is no good without that PIN number.
Okay, we're talking to Kadenia Javis from Javis Financial Services. She is updating us on all of the new tax information. She was telling us about IRS letters 6475, 6419. Both of those letters have to do with the child tax credit funds that you may have received. Now, there's also a letter for people who have gotten some of the economic impact payments. Is that 6575, Kadenia?
That's the 6475.
6475. Okay. Okay.
Yeah.
All right. So 6419 is for the child tax credit. 6475 is for economic impact payments. That money that you got from the government, right?
That is correct.
All right.
And also, Trey wanted to let taxpayers know that for the first time in many, many, many years, the IRS has given a greater inflation rate for the standard deductions, being they added an extra $800 to merit filing joint couples. So this year is $25,000. Is $25,900 if they are single. They're filing head of household. It went up $600. So normally it's only like $150, but this year they raised the limits $400, $600, and $800, and that is the most in a very long time. So they're trying to keep up with inflation, they say.
Let's talk a little bit about some other things. Unemployment insurance and the PPP loans. Let's talk about that. How will that impact folks' tax returns this year?
Okay. So PPP loans. Prayerfully, if anybody received a PPP loan, they have done the form 3508 by the
3508.
SBA to have those loans forgiven. Yeah.
Mm.
If not, it's not too late. I don't think. I need to research that, but they need to do that. They need to do that form. There's no tax implications. You don't have to claim that income. You won't receive a 1099 from the government for that money that was given to you. Even with the EIDL, the economic disaster loans, that there's been some grants that were given out. A lot of people are saying, well, that's income, but because the Congress has not said that they are going to issue 1099 income for that. And I would think that that would defeat the purpose of, you know,
The loans,
regenerate
yeah.
the economy back to, I know it'll never be back where it was, but that would defeat the purpose for them stimulating the economy and then turn around and say, hey, we need you to pay taxes on this
Yeah.
income. So I would keep a record of it in my corporate records. So, if I'm a business owner, but no, you do not have to claim that income. Now, as far as the unemployment insurance, that income, anything over 10,200 is taxable. So
Okay.
a lot of people received, I think the greatest I saw was maybe about 23,000 for the year of unemployment, between 17 to 23,000 for the year for unemployment. But that first 10,200, non-taxable. And so,
Wow.
most of the tax softwares automatically take it off. And if they don't automatically take it off, then your accountant needs to manually deduct it so that you're not taxed on $10,200, because President Biden made that rule change in midway tax season last year.
Right. Some people are not getting any unemployment insurance anymore. Some people have little, less, or no income. What are they supposed to do as far as filing?
Well, people with no income, if they had the unemployment, that is taxable. They need to report that. And if they got the unemployment, well, not necessarily. I was going to say they should have had a job, but pretty much everybody was able to get unemployment. Trey, any documentation that they get with their social on it needs to be reported. If they didn't have any income, you can file a zero return, and that is recommended because, as we know, the stimulus payments were only given to people that were U.S. citizens and had a social security number. So even if you did not have income, we had to go in, file a zero return, non-filer, so that they could get those stimulus payments. Now, we've had 1, 2, and 3. We praying on 4, 5, and 6, right? So if you did not have any income, please still do that non-filer, so that if any in the future, especially the next 2 years that we probably still will be in this pandemic, if any other stimulus payments come out that get passed by Congress, that you'll be eligible and you'll get those funds.
Right.
Because I just want to say, because you had to be a U.S. citizen and have a social security number. That was the only requirements.
A couple of more things I want to ask. What about businesses? Any changes people that have businesses need to be aware of, because businesses were hit too?
The businesses were hit, and definitely they had to show a decrease in their income by 25% with the SBA to get additional, because they're still issuing SBA loans, and those loans are at a low interest rate, 1%. And they are giving us 2 years to start repaying those loans back, and they're financing them up to 30 years.
Wow.
So if you are a business owner and you can prove that your income has been 25% less from 2019 to 2020, you should qualify for an SBA loan. Like I said, crazy 1%. You got 24 months before payment restart, and you got 30 years to pay it back.
Wow.
So you need to, if you're a business owner, due diligence and get those loans, and it should stimulate your business and whatever you're doing. And I mean, we're in a pandemic, but there are resources out there. SBA.gov has a source of things, and also within your counties. Richland County, December 1st, had a $15,000 grant application process that they had. And it closed December 31st. So they had a whole month. And the only requirements was you needed to show that you had at least a 25% decrease in your sales from your products or your services. So
Yeah.
there's help that's been out there, but you have to do the work, and you
Yeah.
have to be in compliance and have a legitimate business. We've had people to call us, can you help me do the application for this grant? What am I going to do it off of? You don't have a business checking account, you don't have a business license, you don't just pull stuff like that out of the air, you know. If you have a home-based business, that's fine, but you still need to have compliance in place.
Yeah.
There are lots of businesses that are home offices. They don't have to have a brick and mortar to be a legitimate business. But
Yeah.
you gotta be in compliance. You gotta be in existence prior to February of 2020 as
Yeah.
well.
Yeah.
So
Yeah. Okay. All right. What about deadlines? What are the deadlines this year? Have there been any extensions yet?
no extensions yet, but as we know, Congress extended it last year from April 15th to May 15th. I foresee the same thing is going to happen again this year. Probably won't get noticed
Right
until
now it's April 15th. Right now it's April 15th, right?
right now is April 15th. The only people who have an extension to February 15th are the victims who were of Hurricane Ida, Louisiana, Mississippi, because that's declared a federally disaster area. But as of now, the rest of us, it is April the 15th.
All right.
But do know if you need extra time, you are allowed to file an extension, but that's an extension to file, not an extension to pay.
Not an extension to pay, yeah. And what about repayment options, Kadenia? What are there any new or different or repayment options if people end up having to pay?
If people end up having to pay, the IRS does have payment plan options available. If you owe $50,000 or less, they would do more financial declaration, sending in information about, your expenses, your mortgage and bills and all that good stuff. But anything 50,000 or less, they'll finance it for 72 months.
Yeah. Before you leave, Kadenia, any advice, updates, information that you want to share with us?
Yes. Definitely file. I prefer for taxpayers to not file an extension, but if you need to file an extension, do that. Also, make sure you wait on those two forms. If you received any you should have received stimulus money, as well as if you had dependents and got the additional child tax credit. Make sure those numbers are correct. If they are not correct and you do an estimate, you are surely to wait to next Christmas to get your tax refund if you're due one. So, be patient, wait on those forms, because some people rush in too early and don't have all their forms yet. So don't rush in too early and, you had 2 or 3 jobs and you only got 2 W-2s. You rushed to go, get your taxes prepared. Oh, I forgot I did have another one. That's going to hold you up too. That's another delay. Remember, numbers, computers, all that stuff linked together. So just be patient with that, and definitely waiting on those that money for your advanced child tax payment, that 6419 form and that 6475. They've already been mailed out. So you should have them in the next week or two. The goal was for everybody to have them before MLK holiday weekend. So we should definitely see them within the next week or two. If you moved, no, they're not going to be forwarded. So you will have to go online. If you need assistance, you can give us a call and we'll assist you in getting those forms to make sure that data is correct.
Yeah, and will they come in a plain white envelope? Well, do you know how they're coming, or will it be clearly marked? A lot of people get a lot of junk mail, and people are quick to throw stuff out.
It is. It's gonna be a black and white letter. The same ones people should have seen them go out when they got their other economic injury payments, letting them know that, hey, your social, you've been approved, you've got $1,200. If you don't have it within the next 4 to 6 weeks, it gives you a telephone number to call, which is 1-800-829-1040, which we all know how long it takes to get through to that number.
Yeah.
So don't have nothing planned when you got to call the IRS on any given day.
Especially not now. Yeah.
Not now. No, not now.
All right.
Also, filing electronically is the fastest way. Direct deposit is the most safest way for getting your refunds, making sure that that routing number and account number don't leave off a zero, because the bank will return it to the IRS. The IRS will then have to send you a paper check, and it takes longer. Sometimes the rush is just not worth just being patient and getting it right the first time.
All right. Kadenia Javis with Javis Financial Services. If you want more information or want to employ her services, you can see her information on the screen, her email, her phone number, and the website. Javis Financial Services is open year round and has a contactless drive-through, the only drive-through tax service ever, anywhere, I think.
I'm sure we're not the first, but in 803, I'm gonna say we are the first.
Right.
I'm gonna say we are the first. And it just works out well with the drive-through, and we're definitely gonna have the same protocol we had last year. Only way you can come in is with an appointment. You can't go to the doctor without an appointment. So we just got to keep this in place, because we got to keep our staff safe. We got to keep our clients safe. And I think they like it also. When they're in the office, they're the only one in there. It's not a lobby, full of other people at that time. So
it's just safer. It's just safer.
And I think we will continue that protocol from here on out, and for everyone's safety. Yes. Just give us a call and we'll get in here. We're doing in person. It's just by appointment only. But that drive-through, drop-off, we're open year-round, starting at 8 o'clock a.m. to now 7 o'clock p.m. throughout tax season.
All right. Javis Tax Services, Kadenia will be back if and when there are any additional updates, as we think that there will be. But we appreciate you coming on. Kadenia, thank you so much.
Thank you for having us.
Absolutely. Go ahead and post and share this information out so we can get the message to the masses about the updates and information you need to know about this tax season. Another thing you need to know about is Medicare enrollment. It's going on now, and Shelli Quenga with Palmetto Project is going to join us next on Coping with COVID. I'm Tre Tailor.
Hi, I'm Kimberly Aiken-Cochran. As Miss America, I know that taking care of yourself is important. Part of taking care of your health is knowing if you're at risk of type 2 diabetes. Prediabetes is serious and puts you at risk for developing type 2 diabetes. 90% of South Carolinians who have it don't know they have it. Visit inittogethersc.org. Take an online test to find out your risk and join a diabetes prevention program. Brought to you by the Diabetes Action Council of South Carolina.
When it comes to you, I have all anything, money, finances, access to. That's what will save you money. Javis Tax Services, only tax drive-through. Javis Tax Services, look up coming to you. Javis Tax Services, handling your money out of hours. Javis Tax Services, now you know what to do.
Visit Javis Tax Service today, 803-419-1001.
Computers, they're a part of our everyday lives. But when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean, and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there, and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
Hey there. Thank you so much for watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. I'm Tre Tailor, and we are streaming live on the TailorMade production pages on Facebook. Please go over there and hit like and share and follow so that you can get notifications as to when to watch Coping with COVID, Wednesday, Thursday, and Friday at 2 p.m. Eastern Standard Time, and then first Monday with comedian George Wallace. Also streaming live on YouTube. Please hit the subscribe button and check out past episodes of Coping with COVID, and check us out on Twitter and on IG. Hey, scrolling at the bottom of the screen, don't forget we've got all types of great resources available, information on finances and testing and vaccinations. Check out the bottom of the screen, and don't forget to post and share so we can get the message to the masses. Shelli Quenga is back, the Director of Programs at Palmetto Project, the state's first nonprofit insurance agency, will share with us information about Medicare. Hey, Shelli, Happy New Year to you.
Hey, Tre, Happy New Year to you too.
Thank you. Thank you. Listen, you have a connection that you need to tell us about between what Kadenia was telling us about as far as filing your taxes and reconciling the advanced premium tax credit. Tell us about that first.
Right. So it was so great that she was your guest because she had so much great info. I was taking notes myself for things I needed. But for anyone who has coverage through the Affordable Care Act, one of the things that they are required to do is to reconcile the amount of tax credit that they've received all year, because that amount is based on your projected income. So then when you file your taxes, you are saying exactly what your actual income is. So if your actual income ended up being less than your projection, then you may be getting some money back. If your actual income ended up being more than what you projected, you may owe a little bit of money. So there is the opportunity then. You should be receiving your 1095 form from the Health Insurance Marketplace.
Okay.
Those will all be mailed out this month. So folks do have to use that form. So you use the 1095 form to complete the 8962 form that you use to put a number into your 1040. So it's a multi-step process, but you've got to reconcile that tax credit. Otherwise, you won't be eligible for a tax credit for the next year. So you can lose it if you don't reconcile it every year.
Right. Form 8962, Kadenia said, is used for reconciliation. So let me ask you this, and Kadenia, if you're still backstage, you can come up and answer this question too, along with Shelli. But Kadenia was saying we didn't have to do it last year. So is that something your tax preparer does? Hey, Kadenia, is that something your tax preparer does once you get that form? Or are you trying to reconcile it yourself? Because I could.
The average consumer not going to know what to do.
I can't do that. That's my skill set.
But yes, Shelli, remember last year, midway, they came about and said we don't have to have the 1095A. 1095B and C has never been used, but 1095A is where you get those premium tax credits. And so you're right, Shelli, when you said about the income, because prior years like 19 and 18, 17, some people would get too much subsidy and have to repay it back. And then those that didn't get enough, as she said, may end up getting a refund if they overpaid. So I am wondering, Shelli, in about 5 years, are they going to go back? Because you know a lot of people, they're going to go back. We never know.
So. Anyway, I don't think so.
They came midstream and said we didn't have to do the 8962 last year. So as of today, we are waiting on those 1095A forms. So that is another form that we are waiting on that comes from CMS, Centers for Medicaid Management, Medicaid, Medicare, the 1095A. And most people know what that form is, because if you did not have it, you're going to probably get a reject and it's going to ask for it. Just like that. Yeah, if you don't have it and they know that you got the subsidy, then you're probably going to get a reject. So that's why I was saying patience.
Yeah. So we'll get that letter in the mail too. But I do know, I remember from last year, you can also go to your healthcare.gov account and get it.
Yep, you can. Healthcare.gov, yes.
One of the challenges, though, is that if people moved and they did not update their address, this is another document that contains personally identifiable information.
Yeah.
So it cannot be forwarded to a new address. So that means you'd have to go into your healthcare.gov account, update your address for 2021 so that 2021 1095B or 1095A will get mailed to you. So even if you went in and you completed your application for 2022 with a new address, if you didn't update the address in your 2021 application, you won't receive your 1095A.
Wow.
So
That's good to
that
know.
part I think
Thanks,
is a little tricky. Yeah, it doesn't go back and kind of retroactively update your address. It just goes by whatever was in your application. So that may be why some people don't receive their 1095A and they have to go into their account. If they've received help from an insurance agent, though, like our team, you don't have your health insurance application is not connected to your online account, because most of the people that we are helping, they don't have to set up the online account at healthcare.gov in order to get help from us. We can do their insurance enrollment without that healthcare.gov account. We are able, though, to access that 1095. So if for some reason they do not receive it, they can give us a call and we can go into a different system and we can pull that for them.
Okay, great. Thank you,
We found out. You're welcome.
Thank you so much. All right, so Shelli, it's open enrollment for Medicare. What does that mean?
So it's so confusing, isn't it? Because I feel like we just finished talking about Medicare.
I was going to say, weren't we just talking about that a couple of months ago?
Yes. So because Medicare is the most confusing health system enrollment, that exists in the world, the Medicare annual enrollment period ended December 7th. Now we are in the Medicare open enrollment period that runs from January 1st to January 31st. That is a period of time when someone who is enrolled in a Medicare Advantage plan can move to a different Medicare Advantage plan. So let's say you're in a plan and you find out that maybe your doctor has switched networks and they're no longer in network. You could switch to a different Medicare Advantage plan. So if you switch anytime in January, that new plan would be in effect February 1. If you switch in February, your new plan would be effective March 1, or you switch in March, it would be April 1. So this is a time when you could make sure that this is in fact the right Medicare Advantage plan for you and make that switch.
So what is Medicare Advantage? How is that different than regular Medicare?
Sure. So there's different types of Medicare coverage. So Medicare A and B are referred to as original Medicare. So they cover 80% of your medical cost, leave you with 20% of the bill, which doesn't sound that bad. It's like what a lot of our employer-sponsored plans have, except there is no out-of-pocket maximum. So it could be 20% of 500 or 20% of 5 million, and that 20% is on you. So that's why people then choose either a Medicare supplement or a Medicare Advantage plan. A Medicare Advantage plan has a network of providers. It has copays, deductibles. It can also include some additional benefits like dental, vision, hearing aids, over-the-counter benefits. That's compared to the combination of Medicare supplement plus prescription drug plan. In that Medicare supplement, you don't have a network you have to worry about. You can go to any provider who accepts Medicare in the country and see them.
Wow.
Yeah. So but you pay a premium every month for that privilege.
Right.
You pay to have it as opposed to not paying anything to have it and paying when you go to the doctor.
Because I was going to say with Medicare, there's not an out-of-pocket payment, so to speak. But then with the Advantage plan, there is an out-of-pocket payment for you to get those additional benefits.
Really, even for your medical care. So like with a Medicare supplement, the kind of Cadillac plan right now, you have a $233 deductible, and that's it.
Yeah.
Where in a Medicare Advantage plan, you could have a maximum out of pocket of up to $10,000, depending on the plan that you choose.
So, what are some of the different plans? So, since people, this is the time through the end of this month that people can switch. What are some of the different plans, advantages, and disadvantages, and why would, some scenarios why someone may want to switch or need to switch?
Sure. So I think the thing that people should really be looking at when they're searching for a Medicare Advantage plan is, are your doctors in network? So can you still see the doctors you want to see? And what is the cost of your care and your prescription drugs? That's where most people spend the most money, is on their prescription drug coverage. So if a drug has moved to a different tier in your drug formulary, what may have been an affordable cost in the prior year may not be affordable in this new year, because the drug companies, they can move those meds around, your insurance company can. So you want to make sure that those costs are affordable. So before you think about switching, you want to talk with someone to make sure your doctors are in network, know exactly what your prescriptions are going to cost you by month, and then look at the additional benefits to compare. So other things being equal, then let me make a decision then on how much dental benefit or how much vision benefit, or do I have over the counter or transportation benefits? So start with the important stuff first that you're going to pay for every month. So you're going to pay for those prescriptions every month. You want to make sure that there's something you can afford, because you need those medications.
Yeah, definitely. So that's one of the ways how you decide which plan is right for you. Like you said, kind of look through it. Now, as I said, about the thing that you and Kadenia were just talking about, people don't know how to do that. Can be very overwhelming.
It is. There's so many plans to choose from.
Yeah. So how and where can people get help to decide if they do have questions?
Sure. So there are tools available online. So if you set up your account at medicare.gov, then you can compare plans on that website. But I still think that site is a little bit confusing, trying to compare side by side. So we do recommend, as you might expect, I'm going to recommend that you talk to a professional and you talk to somebody who is local to you, who really understands the plans. And that you're also talking to someone who is contracted with multiple plans. So, for example, I just had somebody call me today and they said, well, I had an agent from ABC company call me and she said, this is the best plan for me. I said, well, when we looked at plans before, remember, one of the things about this other plan that you're in right now is that it has an all-inclusive copay. That works really well for you because you're going to the doctor often and you have a lot of tests and care. So even though your prescription costs might be lower in another plan, because I know how you use your care and I know about more than just one company, I still think you should stay in this other plan. So if you have somebody who understands more than one carrier's plans, then I think you're really a more advantaged shopper, because you can truly compare and know the difference between those plans, and somebody who understands the network.
And I'm sure someone calling from an insurance company, of course, they're going to suggest their company that they're with. I mean,
exactly. Exactly. And one of the great things about our team is that we're not paid on commission.
Right.
My salary stays the same whether you enroll with us or just call us to get some information. I had somebody call me today to ask about dental plans. With their particular situation, I said, I really don't think it benefits you to enroll in dental coverage. You can get your coverage through one of the federally qualified health centers on a sliding fee scale. So you're not spending your income on a dental insurance plan right now. That means that Palmetto Project isn't receiving a commission from the sale of a dental plan, but that's not the best thing for the consumer. And I'm able to say that and say, no, I don't recommend that you enroll in this plan right now. And that's a really great level of freedom that our staff has to be able to direct people to what is absolutely right for them as an individual, not what is necessarily right for my pocketbook.
Right. Right. So if people do have questions and information, and this is whether they have Medicare, Medicaid, or going through the healthcare website, healthcare.org, how can they contact the folks there at Palmetto Project?
Sure. So the easiest way to reach us is by calling our main number, that 843-577-4122. Or they can also call us toll free. That number rings to our staff. You can set up an appointment to speak with someone by phone. We're getting ready to add on a video chat, so you'd be able to schedule a video chat appointment. And that's especially helpful, I think, for Medicare when maybe you are here in South Carolina, but maybe you have an adult child who lives in another state who wants to help you through your Medicare enrollment. We can do a 3-way video call and be able to have that adult child on and show you the plan so that everybody's on the same page and knows exactly what mom or dad are signing up for and why they chose that plan.
Right. Okay, so people want more information. If you have questions, and like Shelli said, whether or not you are on Medicare, Medicaid, whatever your insurance situation is, going through healthcare.gov, please contact Shelli and her folks at Palmetto Project. They are the first ever nonprofit insurance agency in the state of South Carolina. So as Shelli said, they're not on commission. They're not going to get paid any more, any less, regardless of who you go with. So this is a safe option for you. If you have questions and need some information and advice, please contact Shelli and her team at Palmetto Project. Once again, you can see that information on the screen. Shelli, thank you so much for joining us.
Thanks so much, Trey.
And for all of the great information and the resources you're providing to South Carolinians. We appreciate you.
Absolutely. Same back to you, because I got to go get my e-services number now and do
Right.
that
Me
registration
too.
on the IRS.
Me too. All right. Thanks, Shelli.
Bye-bye.
All righty. So listen, if you have a story or initiative that could help someone cope with COVID, please email booking@copingwithtreitailor.com. If you have a product or service that could help someone cope with COVID, please email copingwithtreitailor@gmail.com. We would love for you to be a proud sponsor, just like SCDHEC, In It Together SC, the Diabetes Action Council of South Carolina, Javis Financial Services, Palmetto Media Connections, the Fifth Circuit Solicitor's Office, Attorney Byron Gibson. We'll talk with those folks next week. Also, Palmetto Painting Services, the City of Columbia, Office of Business Opportunities, Computers Unique, Dutch Square Mall, Agape Counseling and Training Services, Black Pages, Black Expo, and the Comet Bus System. Now, tomorrow, we're going to talk with the folks from the NAACP. They have a virtual MLK celebration going on the 17th. And also, First Baptist Church has an initiative called Project Tech, where they're really reaching out to the community. They have partnered with a company called Evidation, and they are providing some great healthcare resources for people. And they're having an event on Saturday, and they're going to be here tomorrow to tell you all about that and more coming up tomorrow on Coping with COVID. As always, I leave you with a reading. I'm reading this year from Conversations with God from the folks at Agape Counseling and Training Services, Cheryl Williams. Today it says, "Eyes have not seen, ears have not heard, nor entered into the heart of man the things I have prepared for you." God says, because you have been faithful in little, I know you will be faithful in much. I will pour out my blessings upon you that you won't have room enough to receive them. Trust me, God says, with all of your heart, and lean not to your own understanding. In all your ways acknowledge me, and I will direct your path. I am the Lord your God. There is no other. You are growing spiritually, and blessings shall be put upon you 100-fold. Everything is working out for you. I am working behind the scenes for you. Great words of encouragement, and also reminder that if God be for you, who can be against you? This is Conversations with God from Cheryl Williams at Agape Counseling and Training Services. I'm Tre Tailor. Hey, thank you so much for watching Coping with COVID today. We appreciate you, and we wish you peace, abundant blessings. Wish God's blessings on you. Stay well, stay healthy. Please get your vaccine and your booster, and don't forget to wear your mask. You still need to do it over your nose and under your chin. We'll see you tomorrow.
Coping with COVID. Updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by the South Carolina Department of Health and Environmental Control. Visit scdheck.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC. Healthy people, healthy communities. In it together and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, contact Agape Counseling and Training Services at agapects.com. And Palmetto Media Connections, connecting media and communities together. Coping with COVID, brought to you by SCDHEC. In it together, the Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections.
Coping with COVID.